Welcome, ladies and gentlemen, to this Public Safety and Justice Affairs Committee meeting. Roll call, please.
And just as a reminder to all who are in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Mr. Gallagher.
Here.
Mr. Kelly.
Here.
Ms. Conwell.
Present.
Ms. Turner. Ms. Turner is absent at the moment. Ms. Simon. Ms. Simon is absent at the moment. There is a quorum.
Thank you. Is there public comment?
No, Mr. Chair, no one is signed in.
In your packets, we have the minutes of the September 16th meeting. If they're in order, I'll accept a motion in a second.
So moved.
Second.
A motion and a second. Any further discussion? All in favor? Against? Thank you. 2025-0287.
Resolution number 2025-0287, awarding a total sum not to exceed $25,000 to Road Gold Incorporated for the Recidivism on a Decline program from the District 3 ARPA Community Grant Fund.
Oh, my apologies.
She said
I
none.
never had to push the button before. All right.
He said there was none. No, this is legislation.
Correct.
Go ahead, sir. Your name?
Yes, Dale Snyder. How you doing, Council?
Good. Good
First-
seeing you.
First of all, I'd like to thank you for your time. Thank you for consideration of this grant. And I'm not sure, and I haven't been through this process before, but this is a presentation. Per the email, I guess I have a couple minutes to present what it is in a little detail. Rogo Inc. is a nonprofit that is mission to fight recidivism through Class B CDL training. That is the mission, ROAD being an acronym for recidivism on the decline. We at Rogo Inc., we believe that the greatest course of action for a returning citizen is to put them in an economic position to take care of themselves and their families. By doing this, this puts them in a position to be a productive member of society and one that is proud standing within the community. The community needs our returning citizens. We need them in the capacity to where they could be a model to themselves, a model to their household, and ultimately affecting the surrounding communities that they live in. We all know the numbers of recidivism. They're ugly. I won't go over them again. Councilman Turner, how are you? We know the numbers of recidivism. They're ugly. We know that. And I won't go over them, but what I will say as lived experience, the trucking industry, which is a multi-trillion-dollar industry, which is the main vein of our society, of our country. Without trucking, you will not have goods. Without goods, you would not have the economy. Without economy, you wouldn't have the things that we take for granted in this country, such as freedom and military and so forth. Nonetheless, trucking is one of those avenues where a returning citizen does not have to worry so much in a great capacity about their checkered past. If they're willing to work, then they can go into trucking and then they can provide a lifestyle that is lucrative, that is productive, and puts them on the track to not recidivate. And I'm not sure what else. Again, I'm new to this process, so
Okay.
thank you.
Thank you. Are you the principal at?
Yes, I'm CEO and founder. Then I have my president, my vice president with me, Mr. Eric Dillard. A couple of my board members couldn't make it on short notice, but if we need to meet again, I can have the rest of my board here.
Okay, and that's not a problem.
Okay.
Okay, questions? Yes, ma'am.
Thank you. Through the chair to Mr. Snyder. Would all of the ARPA applications, I don't know if it's been explained to you, it'll definitely take 3 readings. This is the first time that it's being introduced. I guess it was read into the record. But anyway, one of the questions in the ARPA application is, how do you plan on sustaining? You know, 'cause this ARPA dollars, American Rescue Act dollars, are one time.
Correct.
So can you please share with this committee if approved, the $25,000, how do you plan, which I'm assuming might get you through a year one, how do you plan to sustain this?
That is a great question. There are several plans for sustainment. The quickest one is to have a vehicle that is a training vehicle and also can be a vehicle that generates a little bit of revenue to put back into the program. Eventually, when retaining a space, the space will be big enough to have a 3PL warehouse. That's third-party logistics. With a third-party logistic warehouse, spacing anywhere from 50 to 90,000 square feet, it can generate revenue anywhere from 1 to 3 million. With that being said, you can put 10,000 square foot of CDL training within that facility and then allow the tax dollars to be gifted to the nonprofit. That way, the nonprofit is self-generating through the business that it is. It has a symbiotic relationship. So that's in a broad stroke. I hope that answers a little bit of the question.
Okay, so through the chair, I'm assuming you have a nonprofit. I'm thinking how the programs have gone. Do you have all of these pieces of the puzzle in place? Like you have the warehouse, you have all of those things already?
I do not have ownership of a warehouse. I do have my eye on a couple, actually. I'm in meetings with a couple council members, city and county, and working that out as well.
So this will be a lease of a warehouse or actually owning one?
The goal is to go into ownership. That is the goal. If leasing is the pathway to that, then leasing it will be.
And so primarily this 25,000, if approved, would go toward a vehicle?
Well, it will go towards not just the vehicle, but some of the basic structuring of the program. It will go towards a vehicle, a simulator, and then also tablets. Now, this will allow the program to proceed before there is actually the warehouse or a housing facility. So the goal is to train individuals and to get them in a career path and on a trajectory to have the funds that they need to take care of themselves and their family. So with that being a goal, I thought the initial 25,000 should go towards what can have that functioning immediately, and then work out the bigger details in the process.
Okay, and maybe final question through the chair. Are you participating or have made any connections with, I want to say Ohio Means Jobs, and I know they've changed their name, guys, towards employment and things of those other workforce training programs? Have you had any dialogues? I'm assuming that your training program could possibly work in tangent with them to get recipients for your program or whatever. I'm just wondering, because I have not had a chance to read your ARPA application, so I apologize.
Excellent question, and it is in the affirmative. I've talked with Towards Employment, been to a couple of their functions, CEO. I've had contacts with, I don't know if I should say some particular names with Office of Reentry, but a lot of those individuals at the Office of Reentry. And just talking about the program, just feeling that I was seeing where I can extract some individuals that are coming home. I recently went into a couple prisons and talked to pre-release to talk to inform them of the program. Some will not be able to make it at the time that I wanted them to, because again, the process for this has been over a year for me now. So But nonetheless, yes, I have made those connections, and not only just with Tours Employment and CEO and the Office of Reentry, but also I've been in trucking when I came home for over 10 years, owned a trucking company, had 3 trucks. So I have relationships that I established with brokers and other carriers, and so those relationships will be recultivated in order to put drivers in position for employment.
Okay. Any costs, I guess, what is the cost that an individual gets integrated back into society? They want to take your training program. Is that where you're picking up the costs to get them through to?
I will afford the program to them for free. I also am working with a couple other grants, and that will allow me to have a contingency just in case some of them may have some dings within their driving record, some fees or penalties that need to be cleared up. But for returning citizens, it'll be free. Now, it is not only exclusive to returning citizens. The program is inclusive to anyone. It's just that returning citizens will be able to have it for free.
Okay. And I cannot remember the acronym, but there was a CSQ or the certification or whatever returning citizens will get sometimes to be able to get back into the job market. I apologize. It's been some years. I can't remember what.
I think what you're referring to, there's a tax incentive for, I think it's like $2,500 for
No,
employer.
it's not a tax incentive. It's actually a certificate. There's some
Okay.
jobs that returning citizens with felonies cannot get into certain jobs. So it was something that the judges do. I can't remember the certification.
No,
Just
I'm
wondering
interested
if,
myself.
okay, so
I'm
just wondering if
interested
that was
myself now.
connected.
What is it? It's an incentive? It's a
No, it's not an
cer-
incentive.
a
It came from
certificate?
the bill of second chances with the governor, and they have to be able to get this certification or pay for this certification in order to continue in certain jobs. But obviously, it's not connected with this. I just was wondering, because trucking is very broad, right?
It is.
Doesn't limit, depending on, based on what your charges were, right? So,
Right.
all right, thank you. I think I've questioned you enough.
Mr. Kelly.
Thank you, Mr. Chairman. So I'm looking over the paperwork while this is all going on, and I see that the cost of this is, total budget is $50,000. And this legislation is for $25,000. So what is the other source of funding?
Great question. There is a grant that I'm also receiving. That'll be another source. Another will be donation, and then another is out of my pocket, to be honest.
Okay, so the total cost of the program would be $50,000 to get it rolling? Is that the idea?
Yes.
And you have, I may have missed it during all this, you have a vehicle?
Well, a vehicle is going to be part of the purchase. A Class B vehicle. I want to make sure I specify that. That's going to be one of the purchases and a simulator. So.
Okay. And then I forget how you, was it returning?
Yeah,
Citizen-
returning citizens, yes.
So there's possibly a chance that they may or may not have driving privileges at this point. Are you going to help with that too?
Yes. Now, let me be clear on that. We fall under DOT, Department of Transportation. So there are federal regulations that, I mean, if your driving record has particular dings, you will not be able to do business on the road. So,
Okay.
Councilman Simon, how you doing? All right. So, if there's something, a lot of times what happens, some of the returning citizens, they go and then when they come home, they have unresolved issues from when they left after serving their debt to society. When they come back, it may be a ticket here or something there. If it's within reason, then yes, we will want to go ahead and clear that for them. If it's something that can't be, then, I mean, It's just the rules of the road.
I mean, the reason I ask is I work in a court, so I know the probation officers often try to help people get their driving privileges back and guide them on the way. Are you going to try to do that same thing, or?
Absolutely, and I'm glad you brought that up, because as I was going about this, I was thinking about returning citizen. The more that just keep consuming myself with this work, I also wanted it to be a preventative measure. So if you work with the courts, I actually want to start talking to all the judges, and if you have an individual that's doesn't have a felony, and they're up for a minor whatever conviction, that this be an alternative sentencing measure. Instead of putting a felony on their record, come to my program. Let me put them on a career path. Let me train them. Let me get them in the truck. Let me get them rolling in a career and see if that measure will be something that will change the course of their life and they not have to fight through some of the climbing pitfalls of having a felony on your record. So I will work with you, any court system, probation officers, anyone that can advance this work.
All right, thank you.
Further questions? Now, this is a program that,
Sure.
that you're providing to these folks. When they complete your program, will they have qualified for a CDL?
Well, the program, they will actually receive their CDL. We're going to take them from
In your program?
start to actually having their Class B CDL, and not only their job placement as well. But the industry is, there's always a shortage of drivers. That's one of the weaknesses of the trucking industry. So job placement is actually very easy, but yes, we will take them from start to job placement, which includes the CDL.
Any further questions?
Just a question.
Yes, ma'am.
Thank you. Oh, it's good to see you, Mr. Snyder. Is this separate from, we discussed the building and the bigger plans that you have, the vision with the
Right.
trucks? This is separate, right?
This
This
is
is
the-
your,
This is a little separate from that. That is the overall bigger goal. So, and I didn't know, Councilman Simon, exactly what this meeting was going to be. So I didn't, I didn't know. So, but yes, this is from what we met about maybe a couple months ago. This is a microcosm.
a
of that.
microcosm.
Yes.
Okay, great. I'm glad you're before us with this and hope you can come back, with the vision that you shared with me
Okay.
at some point.
Okay,
Okay,
thank you.
great.
Ms. Turner?
Thank you, through the chair. I don't have a question, but I wanted to say something to you, Mr. Snyder. How
Okay.
you doing?
I'm doing well. How are you?
I'm well. Good to see you.
You as well.
At first, I thought you was just giving public comment. But,
Oh.
Okay. I wanted to commend you on your unwavering determination and genuine
Thank you.
commitment to uplifting this community. You've transformed your own journey into a blueprint for progress. You've demonstrated what it means to lead with purpose and perseverance. You've participated in public comment. You've listened. You've learned. You've asked questions. You've been respectful in your discourse at times. We appreciate that. But you've been a consistent presence in this chamber, listening, learning, and contributing thoughtfully.
Thank you. Making me smile.
I'm sad that you had to go that route to learn all of this, right? But you exercised your First Amendment, not to just be heard, but to build understanding and partnership. Today, we see the fruit of that engagement. You didn't stand apart from the process. You became a part of it. This is hard. And when you're trying to create solutions for a community, there are going to be challenges. But I'm proud of you. But in doing so, you've shown that collaboration between citizens and government can create real lasting change. So proud of you. Looking forward to seeing this develop and flourish. And all those months of engagement with us, you didn't, I mean, you can be critical of us. That's your right. But you decided to do something about it and work with us in the process. You know, it's easy to come there and criticize us.
Right.
Facts. Proud of you.
Thank you. Thank
Thank
you.
you.
Wow. Okay. Can't stop smiling now. I feel like thank you. It has been a journey.
Sorry.
Go ahead. Go ahead.
Sorry. Anything further? Okay, and this has to go 3 readings because it's ARPA money, so I'll accept a motion if everything's in order on 2025-0287 to the full council for second reading.
So moved.
Any further discussion? All in favor?
Aye.
Against? Good luck.
Through the
Thank you.
chair, may I add my name?
Yes, ma'am.
Thank you.
Thank you, sir.
Y'all enjoy the rest of y'all.
I'll add my name too.
Thank you.
Thank you.
2025-0297.
Resolution number 2025-0297, authorizing a contract with Signature Health in the amount not to exceed $760,753 for the Adult Drug Court Expansion Project.
Good afternoon. My name is Megan Patton. I'm here from the Corrections Planning Board and the Court of Common Pleas. I'm here today on a contract with Signature Health to provide case management and counseling under our drug court through a SAMHSA grant. That court is our medical assisted treatment court, which provides drug court programming to 45 unduplicated participants each year who have an opioid disorder.
Thank you.
Sure.
Questions? I think you
I'll
just
just
got
ask.
lucky.
No, it's a 5-year contract if I can through the chair.
Yes, ma'am.
Is that, what's the term? With
Yes.
Signature Health, and that's between the court and the provider?
Yes, it is. Yes, so it's due to end September 29th of 2029.
And has Signature been the provider?
So they are a new partnership. They've, and a provider for us where we're integrating case management and counseling directly on the drug court team to provide really direct, quick care and support to the individuals in our drug court.
How would that look? The Signature staff would be present at a hearing?
That is correct. So they would be, there's a case manager and counselor that are dedicated to the team. So they attend all of our team meetings with our judge, prosecutor, public defender, probation officer, and any other ancillary team members that we have, providing clinical recommendations to the team in order to continue the person's recovery in the court, and then they'll also attend all the drug court hearings as well.
Thank you.
Mr. Kelly.
Thank you. Just a quick question. This is through, I just saw it here, U.S. Department of Health and Human Services,
Correct.
right? Is there going to be any issues with the government shutdown?
As of right now, no. We have been in communication with our program manager prior to the shutdown, a little bit of communication afterwards, but as of right now, the ability to report those websites are still up, so we're able to provide the documentation that is required.
Okay, great, thanks.
And this new group is taken over for somebody else?
I was not directly. So before we would refer out to different agencies. And this is integrating the case management and counseling into one agency, which is a best practices of a drug court to make sure that we're integrating that. So in essence, we're making sure that they're getting the services, and then those clinical team members are also expert in understanding best practices of a drug court and applying those same things when they meet with the clients.
Right. The reason I ask is the data, it goes back to 24.
Correct.
So these are services that were being provided by this company or the previous folks?
So, no, so it took us, because it was a new partnership, it took some planning to get it off the ground.
We get that a lot.
Yes.
Thank you. Anything further? Yes, ma'am.
Yes, through the chair, why is there an exemption on the competitive procurement?
That's a great question. So in order to apply for a SAMHSA grant and be competitive, we typically identify partners at the beginning to include them in the grant application.
How many more were included? Was it just Signature
It
Health?
was,
or were
yes, and then Case Western Reserve does our valuation.
Anything further? Hearing none, and looking at the timeline, I would assume you need this to move forward.
Yes, sir.
If everybody's comfortable with Resolution 2025-0297 to the full council under second reading suspension, I'll accept a motion in a second.
So move.
Second?
A motion and a second. Further discussion? All in favor?
Aye.
Against? Thank you.
Thank you.
2025-0298.
Resolution number 2025-0298, making an award on requisition number 16156 to Mental Health Services for Homeless Persons, doing business as Frontline Service in the amount not to exceed $1,110,000 for the Children Exposed to Violence Program.
Good afternoon, council.
Afternoon?
Hi, Brandy Carney, Director of Public Safety and Justice for the county, and
Hi, I'm Jill Smilek. I'm Deputy Director under Brandy's leadership.
we just have a few slides, not many, I think 4. We're going to split up here and happy to answer any questions. I do want to first acknowledge the wonderful manager, Witness Victim Services, Kim Bizups, who's in the audience. She obviously runs and manages all the day-to-day in this program. Has really done a great job since she's been with the county the last few years. So this is a wonderful program of ours, the Children Who Witness Violence Program Model. This program started in 1999 within our office. Since that time, Frontline Services has actually been the one that's been contracted for this service that they provide. It's for referral for children who witness violence, referral into services, that they can receive services for the violence that they were exposed to. So we have a quick how things happen. An officer receives a call for a 911. He responds to the scene and he observes a children who had witnessed violence, or maybe someone in the home might tell him that there was some violence witnessed by the children in the home. They often, although it doesn't always happen this way, the officer then reaches out and notifies Frontline. Frontline, within 30 minutes, provides a call to the family, and then if the family wants, these are only services if the family would like to have them, then for that child, they do a follow-up within 24 hours, a face-to-face visit with them. They provide short-term services, and then we also have another long-term for the longer term. And this program can refer into the Defending Childhood Initiative, which is for longer-term services that are provided. Go ahead.
You do the next slide. Okay, so here is just a quick slide with our service numbers from 2022, 23, 24, and 25. So we're generally between 500 and 600 cases each year, so that's children served. 2023, we did have a little bit of a spike, and this year we did have a little bit of a slower start due to some staffing issues at Frontline, but they're back on track to hit right around 600 cases this year, we think. the staffing shortage didn't impact the ability to take referrals and to meet with families, but it did limit their ability to go out to roll calls, to drop off flyers to police departments and things like that. So anytime we do outreach like that, we do see a surge right after, just because it's first and foremost in people's minds. But we do feel that we are on track to serve right around 600 families this year. And like Brandy was saying, we do make sure that kids are screened for ongoing services and referrals to Defending Childhood, which is a longer-term trauma-informed therapeutic model, and also our Camp Hope programming. And so Brandy was saying we've worked with Frontline really since the inception of the program, but we still do an RFP just to make sure that we're spending our dollars wisely. So we released the RFP in May of 2025. We did receive 3 responses. Frontline was just head and shoulders above the other 2. And we are spending about $1.1 million over 2 years. So the contract, if it proceeds, will be December 1st, 2025 through November 30th, 2027.
So I'm happy to answer any questions if you guys have any.
Questions? Hearing none. Looking at
12-1.
you're going to want this to move forward.
That would be great, Mr. Chairman, if that's possible.
Okay. If everybody's comfortable, we'll move Resolution 2025-0298 to the full council under suspension of the rules. Take a motion and a second. I have a motion.
Second.
I have a second. Is there further discussion? All in favor?
Aye.
Against? Thank you.
Thank you, everyone.
2025-0299.
Resolution number 2025-0299, authorizing an amendment to contract number 3970 with the Metro Health System for Correctional Healthcare Services for the Cuyahoga County Jail System.
Good afternoon, council members. Chris Costin, Sheriff's Department. This amendment with Metro Health System is for our in-house jail medical services contract. As you are aware, we issued an RFP in 2024 for a new jail medical services contract. The amendment before you will extend the current contract term that we have with Metro Health to March 31st, 2026, and provides additional funding to ensure services are continued while we work to finalize a new agreement. We are asking for a suspension of rules since the current contract expires on October 31st. Thank you.
Where are we at with the actual contract? You don't know? We don't know?
Greg Huth is here. He could talk to that himself.
Mr. Huth.
Good afternoon, council members, Chairman Greg Huth with the Law Department. We've had one phone meeting with their lawyers, had two in-house or internal meetings with the jail staff, and we've got phone calls on the calendar for every week for the next till we get this done.
Do you have a ETA on when we'll see a new contract?
Well, this gives us 5 months. I hope it'll be less than that.
All right.
So, but it's hard to say at this point.
And the 12 million is for the 5 months?
Correct.
That seems high. Why does that seem high?
Mr. Chairman, if I need Chris to fill in here, but as I understand it is a bit higher than what we've been being billed for currently, for a couple of reasons. One, costs have gone up, but also because they haven't really been staffing at the levels I think we all know they should be there. So this would be sure that there is enough funding available so that if they're able to ramp up that staffing. And just to a point, we get billed for what they spend. If they don't bill us, we don't use all that money.
It's an extension of an existing contract. So we're altering the terms of the existing contract to shoehorn 5 months into it? at a higher rate? Is it a higher rate, or I don't understand why?
Well, I
Because
think
we've
it-
extended this before without a higher rate.
Well, I'm not sure how to define rate in this context.
Cost.
Because the costs are based on what they actually spend. And their spend, particularly on personnel, hasn't been what we need and what they have expected to spend. So therefore, it's lower than what we have been spending. The costs have been lower.
And where does the excess go if we approve this as is?
It only goes there if they have the costs to justify it to us.
And then the money's returned to what, general fund?
It sits there until
It
it
stays
goes
there.
out the door, yeah.
It'll carry over to the new contract?
No, I believe we decertify it and recertify new funds to it, yeah.
So we're not dealing with a different rate. You're just adding money to cover potential costs?
That's the way I interpret it, but if Chris has a different interpretation, you know.
Does this affect the rate?
So it is my understanding too, with talking to Greg, the rates and the costs aren't going to change. It is our understanding that they can be staffing more. I don't know if they could get fully staffed. I'm not on the operations side. So the rates itself aren't going to change, but if they put new people in there, it could cost us more. Or additional people in there. To your question about the $12 million, we only certify what we anticipate to spend per given year. So, for example, we only have 2 months left. We usually get our invoices 2 months behind, so we just paid the August invoice. September, we probably won't get till November. If we're lucky, we'll pay November's invoice the first or second week of December because fiscal gets cut off. So we're only going to certify probably $1.5 million just to be safe. We're averaging $1.3 million right now just for this year. If we certify $1.5 million and it comes in at 1.3, we do certify the remaining. So we only spend what we're only going to certify what we know to spend in a given
And where
year.
does that excess go when it's not certified? Where would, out of 1.5?
So what
to
happens?
1.3, where's the 200,000
Yeah, so what happens,
go?
so when we decertify the contract at the end of any given year, OBM will decertify the appropriations in our budget itself. So it's not like we're gonna, take it and use it next year. We just decertify the appropriations, which goes back into the general fund.
Right, well, you couldn't, because it's only a 5-month extension. After 5 months, my concern is, where's that excess go? Back to the,
We just decertify the contract and decertify the appropriations. It's
Okay.
unspent funds, it's unspent appropriations, so it's not like, it's like we not even used it.
and the rate hasn't changed.
I did not see anything about rates itself, so to my knowledge, it's just for, in case they hire additional staff, it's just to cover additional expenses.
Okay, any questions? Yes, ma'am.
Through the chair to Chris, first question, which department or which budget? This comes from the general fund, right?
Through the chair to Councilman Conwell, yes, it is general fund budget.
Okay, and can you have Metro give a clearer picture of when they will have more staff to go into those positions? They're laying off, so.
Yeah, again, I'm not on the operations side. I mean,
And who's on the operation side? We need.
I
them to
believe Chief Rivera has a contact with Metro about the operations itself.
Right, and Metro's layoffs were ancillary personnel, not medical.
No. But the problem and what I've been working on with HHS and some future legislation is these unspent funds. This is what we're facing in the budget. There's a lot of dollars that are being procured and put into other people's departments as a hold. Then they don't have it. It's still in the general fund, but at that point, the county cannot use it because it's sitting in a fund. So that's where I have a problem with this. According to the chair, this is 5 months of money that would be just held not for us to be able to use it, which we're in a crisis to need funds. So that's why I was saying if you could reach out to Chief Riviera and get some kind of answer from Metro to give us a clearer picture or an estimate or a guesstimate when they're gonna have these employees fill this
Well,
position.
ma'am, as long, and correct me if I'm wrong, so this is extra money in anticipation that Metro will be able to upstaff what they have right now. If it's not used, it goes back to the general fund after 5 months where we anticipate the new contract, I assume with Metro or whomever, will be on the table.
Correct.
Does that help?
But we don't decertify, we only I guess my question to you, Greg, is do we only decertify at the end of the year? Or can we decertify immediately at that 5 months?
We can decertify at that 5 months
Okay.
when we're ready to bring the new contract forward.
I still think that we need a clearer picture of, outside agencies that we work with, they don't give us clearer pictures of when they determine that they're gonna, and then the money sits there. And what we're facing with the budget now is that technically we're trying to claw back or utilize funds, and then people come up in front of us and say, well, we're cutting them. We're not cutting them. They didn't spend it. So I'm trying to really go down a path of let's be as consistent or as clear into the money that we're going to use or need, instead of just having them siloed off to the side and sitting in different contracts. So
What was the initial ask? Yeah,
Dollars?
yeah.
I'm not gonna
Was
say
it the 12?
It's a little bit lower.
So when we were working on it, they asked what I recommended. It was about 8.1 million, and that was for the 6 months.
And then it went to 12.6?
And then, yes, and then about 2 weeks ago, I got an email saying it's going to be at 12.6. And then last week, I just realized it went from 6 months down to 5 months.
Who changed the number?
Well, I mean, I did with the back and forth with Metro.
Could you explain further?
We were negotiating over time and money over the extension. And, we worked from 6 to 5 and numbers went up and down. That's how negotiations work.
Yeah, I understand. And to the councilwoman's point is, although I understand that after the 5 months, if the money's sitting there, that goes back to the general fund, which takes care of that part. It's just, this is just all in anticipation of Metro really kind of saddling up with a full contingent over there, which we don't anticipate, I would imagine. So this is kind of belt buckle and suspender kind of.
You would say that, but at the same time, if I may, that you don't want to be in a position of, I guess, administration, we don't want to be in a position of having to come back on an emergency basis, right?
Well,
But, and as Chris
that's every day for us, it seems. I mean,
Fair enough. As Chris said, we're only going to certify about $1.5 million for this,
1.5
for this year,
25, yes.
for this year. So I think by the end of the year, we'll have a better idea of what the spend is.
Ms. Conwell, is that sufficient for you?
no, I recommend letting this go to 3 readings and bring in Chief Riviera to, or at least, he doesn't
he's
have
right
to,
here.
right, well, he can talk with me online so I can further understand this. But October 31st, so for me to be clear, Greg, the contract or the agreement of moving forward, which we know is very important to have our healthcare services for the inmates, has not been finalized. Or it has.
The new contract.
The new contract.
No, we've just getting started on it. That's why we need the 5 months
Yeah, that's what
extension.
I have a problem.
Yes.
So we're giving extra money for 5 months, and we haven't even determined what that rate would be. So,
No,
No,
the rate hasn't changed.
The rate is the same.
Okay.
It's just that we expect or hope,
We expect a new rate with the new contract in
I would-
5 months.
I would expect so, yes.
Okay.
Yeah.
So this is really to tide them over for the 5 months.
Right.
And if there is extra dollars that they don't use, it goes back to general
I
fund.
get that, but it's more, it's still more than what the previous contract was.
No,
No,
excuse
the
me.
request was, I see where you're going. The request was 8.1, the determination was 12.6, and I think that's where the councilwoman's having a problem.
Yeah, and the 8.1 was based on what their current spend is. but their current spend hasn't been sufficient. I think both sides agree, has not been sufficient for the personnel. They just haven't been able to get the people they need in the jail. So this is anticipation of them being able to do that.
I get it, current spend is at 8.1, but without a contract going forward finalized, who came up with what was the 12 million based on? I mean, that's a big jump for,
If I may, it's based on the county's expectation of the staffing that's needed there.
but who picked the 12 million that we have in front of us, the 12.6?
It was a number that came between their lawyer and me.
And what was it based on?
It was based on what the current staffing model that was in, I think we put in the third amendment to this contract. This is number 6 or 7. It was based on that.
So in your estimation, Greg, how long will it take for negotiations, which I thought it started already, with the jail contract going forward?
I'm always hesitant to put a number on something like that because it's a very complicated contract. It's a very complicated relationship, as you know. So I'd like to, I'm not swearing to anything. I don't want you to hold me to it, but, I hope we'd be back here in January.
I'm going to vote no today. People got what they
I
want.
I see your concern, but I think the answer is this is in anticipation of Metro being fully staffed at the jail, which we really don't anticipate. So you're kind of throwing this in there in case,
Correct, yeah. That's
rather
fair, I think.
than go with the 8 and then come back, which I don't think anybody has a problem with. But as long as it's noted that any excess goes back to the general fund if these numbers aren't attained by Metro, which we anticipate they probably won't until we get into a new contract, which you're hoping will be in January.
Hoping.
Okay. Yes, ma'am.
So the 8 has been deemed inadequate, right?
Correct.
It was not sufficient in the past to cover the actual work,
If they had been fully staffed, yes.
right?
So the way I, through the chair to Councilwoman Simon, the way I project is based on actual spend in the last couple of months. Where I got the 8.1 is year-to-date, we're at 1.3 average for the first 8 months. And then I took that out 6 months at the time, but that's before I knew the contract went back to 5 months. So when we go to certify for 2026, I'm gonna look at November and December and September invoices and say, hey, look, this is our average. I'm going to take this out 5 months and only certify maybe another 6 million at the beginning of the year, knowing the contract holds more value in case we need more money, down the road. But I'm only going to certify what I think we're going to spend for that given year, if that answers your question.
So the entire 12 is not certified on the front end?
No, it's not certified, no.
So that money's still in the general fund, ready to be,
Right now, it is. And I can't certify, one, until this gets approved. And I'm only going to certify maybe 1.5,
Okay.
just in case we have an invoice in December, and then the rest will be 2026.
Okay.
okay, well, it's essential, we have medical care at the jail, so we have to extend the contract 5 months, and if you're not going to certify the entire amount upfront after this is hopefully voted on, then I'm okay with this.
I would ask, Mr. Chair, I would ask that we do 3 readings on this. And give me time to sit down with Chief Rivera.
If this isn't moved today, where are we at?
Mr. Chairman, we'd have a problem because the current contract expires at October 31.
And the chief come up.
We'd have a gap because this is the only, the 28th is the only other meeting between now and the end of the month.
Right, so we got a time problem.
Yes, as per usual.
We can still move it out of committee, and I'm sure me and Chief can sit down and have a conversation before it goes to the council.
Right. That's another week.
Yeah, I don't,
I think your concern is dealt with what Councilwoman Simon was just saying with the certification. So I think we're covered there. and that was the concern, where would the excess go? Well, it's really not going anywhere because it won't be
Gonna stay,
certified.
right, it stays in. I'm
So
clear
it's,
with that.
it's still where it's supposed to be until needed, and we can't let the contract, unfortunately for us, expire, so.
I get all that, I understand all that. What
All
I'm
right.
having an issue with is that they're in actual negotiation deals, and they've negotiated or gonna pass in this contract, a determination of amount of money, which Chris has explained how he came to the figure before the actual contractual is
Well,
finalized.
there's two things. This is the extension, and they're working on the new one, which we anticipate will be higher regardless of who the provider is, so. Okay, confusing, but I think we're there. If everybody's okay with Resolution 2025-0299 to the full council under second reading, suspension, and Councilwoman Conwell will be meeting with you to satisfy her concerns.
Thank you.
I'll accept a motion in a second.
So moved.
Second.
A motion and a second, further discussion. All in favor?
Aye.
Against? Thank you.
Thank you.
Under miscellaneous, Ms. Simon, did you want to address the new policy, or
Sure, I can.
the sheriff's here and his
Sheriff's
staff?
here. I want to thank the sheriff and the team for coming up with a policy that's what I anticipated would benefit the county overall with safety to the county and safety to the residents. And I'm really pleased. We came up with I don't know if the sheriff wants to come up, a policy that says that the chases, pursuits will only occur, generally speaking, for a violent felony, opposed to a minor misdemeanor or misdemeanor offenses for traffic. So that's where we landed, and I want to thank the sheriff for helping get that through.
Through the chair, the councilwoman, thank you for your support, your partnership in that, and a lot of wordsmithing, a lot of work on that, and thank you to all the support from council and from the other partners who came together and helped us chip in on that. It's just always about looking at things in different ways and seeing how we can do things better, how we can optimize policies, because policies kind of guide our operations. Operations are important, and they're supported obviously by policies and by our community. So we felt that the change was appropriate and it was welcome. So thank you.
And Sheriff, you want to speak to the new name? Instead of the downtown
Yes,
patrol,
Community
safety patrol?
Support Unit. We figured that the Community Support Unit is reflective of the actual function that the unit conducts, because those deputies move throughout the county, not only on their own, but also subsequent to requests from police chiefs and mayors throughout the county. So we felt that that was absolutely more reflective of what they do, what they've been doing, but now their focus is going to be, where can we go? And just this weekend, they moved in throughout different communities, and we feel that that's important.
Well, it's been a pleasure working with you and your team. I really appreciate everything. The earnestness, of coming to the table and being open and bringing so many of your members to the table and working with our staff. So it's a great outcome. Thank you again.
Mr. Kelly.
Thank you. Sheriff, has there been any requests for them, for the support?
Through the chair of the councilman, not yet, sir. Not yet, just normal things that have come in, but specific to their functions in the past week, outside, no, we have not.
Have any of the communities been notified that we have this support unit now, if they do want to?
Through the chair of the councilman, I'm going to make the announcement again to the County Police Chiefs Association. I met with them before, but now that it's all changed and in order, I think it's appropriate to remind them, hey, if you need some assistance, please, we're here to help.
Thank you.
What's the process?
The police chief or the mayor would reach out to myself or even executive staff. But I think if they reach out to me, I will inform the major or chief to direct a sergeant to contact whoever they identify, whether it's their shift lieutenant, shift sergeant, or whoever, and determine what the issue is and go from there.
Right, if we can get that out there too, because I know they'll probably want to know the process. Not everybody will use it, but you never know. All right. Oh, yes, ma'am.
Can we make sure, Sheriff, that you're keeping that on a spreadsheet? Who utilizes, what communities utilize it?
Through the chair of the councilwoman, yes, ma'am, and that's part of the process, knowing what community, a little snapshot of what the function was, whether it was a traffic control function or vehicle break-ins or high school football game. And my apologies, Chair, I did just remember, yes, we did have a request from the city of Euclid for the football game where we partnered with them on that. So, but yes, ma'am.
So at the end of the year, so I don't know when it went in effect technically for the community impact unit, but it must have just occurred. So can you give us a report at the end of the year to see where we are?
Through the chair, to the councilwoman, yes, ma'am, we'll do the entire year, and then we'll break it off. I believe it was 2 weeks ago, we changed, the official change of the name, but they've been conducting that function, and you'll see at the end of the year, at our report, you'll see how many cities they've served throughout the entire year. No problem.
Thank you.
Okay, very good. Anything further?